The Fitterist Show with your host, Christopher Allen, where we explore the art of mind and body conditioning. According to the Center for Disease Control, the CDC, nearly 75 million U.S. adults have high blood pressure. And high blood pressure puts an added strain on your heart, possibly leading to cardiovascular disease and other complications. And while there's no magic bullet to lower blood pressure, lifestyle changes combined with things like exercise, quitting smoking, and dietary changes can all contribute to lowering one's blood pressure. So today's episode, we're going to take a look at 10 different foods you can add to your diet to help, in conjunction with lifestyle changes, to lower your blood pressure. But before we talk about blood pressure, let's take a look at stories in the news. This first news story is an interesting one. It caught my eye because of the title is Relaxation Makes Worriers More Anxious. So this is a new study out of Penn State University in College Park, Pennsylvania, that finds that relaxation techniques and relaxation exercises to reduce anxiety for some people, they actually have the opposite effect. In this group of people, relaxation conflicts with a strategy that they employ to lessen the impact of negative events through continual worrying. I know, sounds interesting. Hence, why we're talking about it. So the premise of this is centered around something called the contrast avoidance model. And this model postulates that individuals that have a general anxiety disorder, GAD, they fear a sharp spike in negative emotion, and thus they actually prefer to worry to maintain their negative effect rather than being in a more relaxed state. Now, this relaxation-induced anxiety is a bit of a paradox because the people experience a spike in their anxiety during relaxation training. So if it sounds ironic to you, it's because it kind of is. The irony is that given most of the things that one is apt to worry about never actually occur, in this group of people, the brain's takeaway could be, I worried about it and it didn't happen, so I should continue worrying. People may be staying anxious to actually prevent a large shift in anxiety as well. But it's actually healthier to let yourself experience those shifts. But they go into a state where they prefer to worry at a steady state rather than experience large swings of intense anxiety and worrying. But the more you actually allow yourself to try to relax, the more you realize you can do it. And it's better to allow yourself, certainly, to be relaxed at times. So the study was conducted with 96 college students in this new study. This included 32 participants with a generalized anxiety disorder and 34 participants that had a major depressive disorder, or MDD. And there were 30 participants in the study without any disorder that served just as a control group. So the results were that the researchers found that the people with the generalized anxiety disorder were more sensitive to this extreme emotional shift, and they tended to feel the most anxiety while practicing relaxation techniques. So people who were more vulnerable to this relaxation-induced anxiety are often the ones with anxiety disorders who may need relaxation actually more than other people. So not overly surprising, the insights in the study actually suggest that people living with generalized anxiety disorder may benefit from follow-on research. Measuring the relaxation-induced anxiety and implementing exposure techniques targeting the desensitization of this negative contrast may help patients reduce this anxiety. In addition, the researchers also posit that mindfulness training and other interventions can help people kind of interrupt their anxious disorder and help them live a little bit more in the moment. So the goal of this research is certainly a good one, and that is to find basically improved treatments for both generalized anxiety disorder as well as major depressive disorder. So an interesting study that will serve as a basically foundation of further research to help at least move toward improved treatments for these anxiety disorders. And next, So if you thought the first news story was interesting, this second news story is even more so. Coming out of MIT, the study is around mucus contains powerful sugars that tames germs, or as I like to call it, the power of snot. So this study was published Monday in Nature Microbiology, and it demonstrates that mucus has an unexpected beneficial property. It contains these sugars that keep potentially harmful germs in check. Now, I didn't know this, but probably not surprising. Our bodies produce about 1 liter of fresh mucus each day. That's a lot of snot. So mucus coats our passages and tracks inside our body from our nasal passages to our esophagus to the lining of our stomach. It filters much of the air you breathe, trapping dust particles, bacteria, and other things before they get into your lungs. But the focus of this new research was on compounds called mucins, or mucins, M-U-C-I-N-S, inside the mucus. And these are long polymers that are densely studded with sugars. Now, most people, when they think of mucus, they think of a liner that traps dirt particles for elimination from the body. Now, that's not exactly true. Inside a glob of mucus, bacteria actually can swim freely. That actually benefits our immune systems. A lone drifter, or a lone bacteria drifter, if you will, as opposed to many germs gathered in tough-to-penetrate clumps, makes it easier for our bodies to target for immune cells. But not all bacteria actually need to be killed. Only a minority, in fact, are even harmful. Remember, we have trillions of microbes growing outside and inside of our body. We have microorganisms that live in the mucus of the digestive tract to actually help process food, just as an example. Now, previous research has showed that purified mucins prevented several types of potentially harmful microbes from clumping up. This new study, though, is the first to really identify that the sugars grafted to the mucins is the element that is actually responsible for suppressing these antagonistic microbial behaviors, so the bad bacteria. So this particular study tested how the sugars interacted with a bacteria called Pseudomonas aeruginosa. The microbe does not normally cause disease except when it infects people with cystic fibrosis or those with compromised immune systems. So the scientists wanted to know whether sugars actually work by themselves, and the Pseudomonas bacteria reacted to the sugars by becoming less infectious. So the mucus compounds suppressed the various genetic pathways of the bacteria, including factors related to killing other microbes, toxin secretion, and cell-to-cell communication. So the implications of this research suggest that sugars can tame other types of microorganisms that are potentially harmful, including yeast and even the bacteria Streptococcus, and the potential of these sugar molecules to help as certain strains of bacteria become resistant to drugs meant to kill them. So changing the bacteria's ability to cause infections could be a really potent strategy in targeting specific harmful bacteria in the future. So it's kind of interesting. The summary, of course, snot's pretty powerful. And now, on to the 10 foods that can help lower and control your blood pressure. So high blood pressure refers to the pressure, obviously, of blood against your artery walls. Over time, high blood pressure can cause blood vessel damage that leads to things like heart disease, kidney disease, potentially strokes, cardiac events, other problems. Not good. High blood pressure, or hypertension as it sometimes is called the silent killer because it really produces no super visible and evident symptoms and can go unnoticed and untreated for many, many years. According to the Center of Disease and Control, there are about 75 million Americans that have high blood pressure. There's a lot of different risk factors that contribute to high blood pressure. Some things are out of your control, such as age, your family genetic history, gender, your race, but there's also a great number of factors that are absolutely in your control, such as exercise, whether or not you choose to smoke, your diet, and overall lifestyle. And a diet that can help control blood pressure is generally rich in things like potassium, magnesium, and fiber, and a little bit lower in sodium. So this list is not meant to be a fully exhaustive list, but a guide to foods you can easily add into your diet plan. As always, one should consult with their doctor or healthcare professional to develop a fully comprehensive plan against high blood pressure, if indeed you have it and it is deemed necessary. All right, so let's get on to the list. First food on the list is bananas. They contain plenty of potassium, a mineral that actually plays a vital role in managing high blood pressure. Potassium reduces the effects of sodium and alleviates tension in the walls of the blood vessels. So adults should generally aim to consume around just under 5 grams or 5,000 milligrams of potassium daily. And there's other potassium-rich foods that include things like sweet potatoes, avocado, cantaloupe, halibut, tuna, tomatoes, mushrooms, things like that you can add into your diet. Food number 2, leafy greens. When is a salad or good, healthy kale spinach ever bad for you? So not surprisingly, it's on this list as well. So things like, as I mentioned, kale, collard greens, spinach, beet greens, Swiss chard, arugula, all those things can help with lowering your blood pressure. Food number 3, berries, specifically blueberries. They're packed with nitric oxide, so this is a gas that helps to increase blood flow, thus lowering your blood pressure overall. And there have been studies that have found that even less than an ounce of blueberries a day can help significantly lower blood pressure, so stock up on the blueberries. A fourth food is beetroot. Now, this beetroot contains certain antioxidants that help in managing high blood pressure levels in general. And there have been some studies that have actually shown that drinking just 1 glass of beetroot juice is an effective remedy to combat high blood pressure levels. Beets also contain another compound called nitric oxide, which again helps to manage effective blood flow. I personally add in beetroot powder into my greens shake in the morning, my green drink in the morning, just as a safety precaution. Why not? Easy way, because I'm not a big beet fan. I'm not a big, let's fire up some beets, get a big bowl of beets, and just chow down. But the powder, mixing in with some other greens and some other things, tastes pretty good. Number 5 on the list is Oat Bran Oatmeal. Oat Bran makes a pretty healthy choice for breakfast. It has a lot of fiber, and it can certainly help in lowering blood pressure and improving digestive health. Oats in general are rich in potassium, which is, as I mentioned earlier, a significant mineral for blood pressure control. Item number 6 is pistachios. They're a healthy way to decrease the blood pressure. And one study even found that a diet with 1 serving of pistachios a day actually helps to reduce blood pressure. And pistachios taste great. They're awesome. Item number 7, salmon. And I'll include things in there like mackerel and fish and any fish with omega-3s. It's not only a great source of lean protein, but they're also high in omega-3 fatty acids, which can lower blood pressure, reduce inflammation, and lower some of your triglyceride levels. Food number 8 is walnuts. Walnuts are one of the only tree nuts that are significantly higher in plant-based ALA, or alpha-linoleic acid, which is a plant-based form of the omega-3 fatty acid. Regular consumption of walnuts has shown to improve overall blood flow, and they also have a lot of healthy fats. They also have magnesium, and they're good on the fiber front. Item number 9 is garlic. Garlic is a natural antibiotic and antifungal food. There has been some research suggesting that garlic increases the body's production of its own nitric oxide, which again helps the muscles to relax and the blood vessels to dilate, again effectively lowering your blood pressure. Item number 10 on the list is dark chocolate. This is based on a study that found that eating dark chocolate is associated with a lower risk for overall cardiovascular disease. This study suggests roughly 100 grams per day of dark chocolate may help out with a lower risk of cardiovascular disease. Now, a couple bonus items too. I mentioned one of these in the previous list, sweet potatoes, which are just a great food overall for health and to help control blood pressure. It has a lot of magnesium. It has a lot of potassium. And these 2 minerals definitely help regulate blood pressure. Sweet potatoes can't go wrong. And another bonus one I'll throw in there is flaxseed. There's a lot of scientific studies that have supported the fact that consumption of flaxseed can bring improvement in high blood pressure levels. So eating flax seeds for, a longer period of time, the studies show roughly 6 months can lower both systolic and diastolic blood pressure over time. So while these are a list of foods that can help lower blood pressure, some general foods that you want to avoid or at least monitor your intake. The first of these is sodium, which can significantly raise blood pressure. So lowering your overall sodium intake can result in reduced systolic and diastolic blood pressure. The second item to at least monitor is caffeine. These can cause, these things are in coffee, tea, cola. There's tons of caffeinated beverages, pre-workouts. All of those things can definitely cause a short-term spike in blood pressure. However, these studies also found that coffee increases blood pressure in the short term, but they don't necessarily suggest that coffee increases blood pressure or increases the risk of cardiovascular disease in the long term. And a third element to avoid or limit is alcohol. Aside from having absolutely no nutritional benefit whatsoever, consuming moderate amounts of red wine can have some health benefits, but larger amount of alcohol can dramatically increase blood pressure and the risk of obviously heart failure, cancer, and obesity. So in summary, through a heart-healthy and well-thought-out diet, you can reduce your risk for high blood pressure, hypertension, and promote overall good health. An appropriate dietary approach can actually be significant in managing high blood pressure. Again, there's some factors that are in your control, some factors that are not in your control. Your diet and your lifestyle are absolutely within your control and can absolutely have a non-trivial impact on reducing your risk of high blood pressure. And foods that may lower blood pressure include things like fruits, vegetables, oats, nuts, lentils, herbs, spices, and incorporating items from this list into a balanced diet and making sure that you're getting enough adequate physical activity and making the right lifestyle changes, no smoking, moderate to light consumption of alcohol, can absolutely help you treat and lower your blood pressure and improve your overall health. With that, I'd like to thank you for taking the time to listen to The Fitterist Show. You can follow us on Instagram at FitteristMindBody and on Twitter at FitteristMind. If you enjoyed this episode, please send it to a friend or subscribe to make sure you don't miss any future episodes of The Fitterist Show. My name is Christopher Allen, and make it a magical day.